The first part of immune system function is the lymphatic system. And recall when we were talking about blood vessels and capillaries, we said that capillaries leaked fluid out and they were able to reclaim most of it, but not all of it. So the lymphatic system, and you can see the little pop out here of an individual lymphatic capillary and duct here, would pick up that excess fluid. And that's going to work on a pressure concept. So if you are physically active, that's going to help increase the pressure that would push that extra fluid into those vessels. So the more physically active you are, and I think I mentioned this in blood vessels as well, the more physically active you are, the easier the lymphatic ducts pick up that lymph, that leaked fluid, and get it out of that tissue, which then reduces the swelling. Some people's lymphatic systems don't do that great of a job, and something like, let's say, salt consumption might cause a person to have a lot of swelling occur. And often those people might also have a fairly sedentary lifestyle. So those two things can come together to make the lymphatic system not work as well as it could. That fluid is then, once it's moved into those lymphatic capillaries, goes back to lymph nodes. And so there are far more lymph capillaries and ducts than you see here in this picture actually in the body. Everywhere you have a capillary bed, you have a lymphatic bed as well. But these are the main lymph ducts here and the main lymph nodes. And the lymph node is a filtering unit. So you've picked up this fluid from the tissues, and one possible cause for a lot of fluid being in the tissues might be an infection. So if it's in that area, in the fluid, it could be an infection, and then it can be picked up in the lymphatic system. And the last thing in the world you want to do is take an infection, let's say in the finger, and distribute it throughout the body, taking it from a localized infection to a systemic infection. So the lymph vessels actually take that fluid, potentially containing pathogens, and they're going to run it through a lymph node. And there are clusters of lymph nodes throughout the body. In some areas you have bigger clusters. So in the armpit region you have a pretty good sized cluster of lymph nodes. In the pelvic region you have a pretty good sized cluster. Probably the most famous cluster is up in the neck, in the tonsil region. And in the back of the head is going to be another batch. And so scattered throughout those areas are these lymph nodes, these filters. And if there is any kind of contaminant in that fluid, it gets filtered out, hopefully, by those lymph nodes before that fluid is then put back into the bloodstream again. This is why the doctor checks lymph node areas. They're checking for potential infections, and if they find swollen lymph nodes, that means that some kind of stuff, some kind of potential infection is being filtered out at that point. And it gives them an idea of where it is based on which lymph nodes are swelling. So the lymph nodes closest to the area of problem are the ones that will become swollen and enlarged, telling you to some degree where the problem is. The tonsils are probably the most famous of them because they're the most obviously noticed. If your tonsils are swollen much, you'll feel it. You'll know that something's off there, even if you're experiencing no other symptoms. Lymph nodes are where they also check for cancer. So if a person has been diagnosed with cancer somewhere, they're going to check the lymph nodes around that region. Because if that cancer has metastasized, it will most likely be picked up by lymphatic vessels and will then most likely be found in the closest nearby lymph nodes. Breast cancer is one of those. So when you're ladies doing a self-breast exam every month, you check not only the breast tissue, but you also check in the armpit regions, because any lymph nodes there would have picked up a potential problem that might have originated from the breast tissue. So again, the doctors will check those areas, and if they don't find anything in the lymph nodes surrounding the area where the cancer was isolated, then they are probably going to feel fairly confident that it has not spread. Most of the time when cancer spreads, it does so at least partially through the lymphatic system. Your immune system has two different layers or levels of protection, and the first are innate defenses. Innate defenses are automatic. They're always in place 24 hours a day, 7 days a week, and they're general purpose. So the first of those, and perhaps the most important of those, are barriers to entry. Skin, mucous membranes. And as long as your skin and mucous membranes are intact, they're not damaged, they're not compromised, then many pathogens are unable to penetrate them. It's a relatively small number of pathogens that can relatively easily penetrate these barriers to entry. Obviously, the skin on your hand is much more protective than the mucous membranes of the mouth. So most pathogens that get in, that didn't get in through a compromised barrier to entry, got in through the mucous membranes. And they're thinner, they're more easily damaged, they're always moist, and so that makes it more likely of a place for pathogens to enter. Which is why you're always supposed to keep your hands off your mouth, face, out of your mouth, out of your nose, that sort of thing, because anything on the hands would then be transferred to those more delicate, more easily penetrated membranes and be more likely to result in an acquisition of a disease. Protective proteins are present that are always looking for problems and perhaps binding to them very rapidly if they happen to find something. And we'll look at those a little bit later, but those are complements and interferons, and we'll look at those specifically in a minute. Phagocytes and natural killer cells are always floating around, and they're always looking. So here's one labeled as a dendritic cell. They're always looking for things they don't recognize. And if they don't recognize something, they simply eat it and ask questions later. The fourth piece of the innate defenses is the inflammatory response, and that's an incredibly important piece of the puzzle that we'll look at in more detail here in a moment. How about right now? So in a tissue damage scenario, the first thing that happens is injured tissue cells release histamines. Histamines are naturally produced inflammatory chemicals that cause or drive the inflammatory response. And the first thing that happens with the inflammatory response is the attraction of fluid. So that region swells. Blood flow to that region increases. You'll have macrophages. Those are some of those dendritic cells that we saw earlier that are just eating anything that they find. They're going to be attracted to these areas of increased histamine, and anything they find there, they will hopefully do a good job of cleaning up. So if you have pus at an area of injury that has occurred, that's these macrophages, these white blood cells that are being attracted to this area where histamine levels have increased, and they're actively dealing with an infection of some sort. So pus is just an indication of the immune system doing its job, and as those cells exhaust themselves, they die and accumulate as that visible pus. White blood cells then diapedese, and that's a fancy word for they go from inside the blood vessels to outside the blood vessels. They sort of squeeze through the capillaries there and enter the tissue in greater numbers to help out with eating whatever problem might be present. And then the last step in the inflammatory process is to clot any kind of damaged blood vessels that might have occurred so that you don't experience additional blood loss. Now, an important part of tissue damage always includes bleeding. And the idea of bleeding is to hopefully wash out any particular pathogens that might have entered. So really, bleeding is the first step of an immune system response to a problem, to a damage, and hopefully that means they don't need the rest of these processes going on here, but they're going to happen anyway. And because this area becomes so swollen with this increased fluid and these extra immune system cells, that then sort of blocks the area off and hopefully prevents pathogens that might be in that area from spreading. So inflammation helps to attract the immune system, and it helps to try to isolate this potential infection to a small area. Now, we're tempted when we experience a lot of inflammation as part of this process, we're tempted to take an antihistamine and cancel it out, or to take a Tylenol or an ibuprofen or something like that, and those typically reduce inflammation. But remember, we're actually turning off part of the body's natural immune response when we do that. So you probably don't want to take those sorts of things unless you really need it. Mild fevers, mild inflammation and swelling, let your body do its thing, because if you take those medications, it turns off some of your most useful processes and might actually then allow that localized infection to become a systemic infection. And that's obviously going to be much more difficult to deal with. So we don't like the inflammatory response necessarily in terms of what it does to us, but it is a very important function. So again, if it's not causing major problems, leave it alone. Here is the complement proteins that I mentioned earlier. And complement proteins do a number of things. They help to identify problem particles. They help to stimulate the immune system to be more active and more aggressive in every aspect of its function. They help to stimulate the inflammatory response. And they do a really cool thing here with what's called a membrane attack complex, or MAC. And that is they poke holes in the membrane of this particular pathogen. And once they form a ring, basically that allows fluids to very easily go in and out of the cell. And what often happens is fluids move into the cell, which then causes it to, as you can see at the bottom here, to explode. So basically we've stabbed it to death. And so that's a really handy sort of tool that's used often to directly kill pathogens and to just stimulate everything else that's going on at the same time. Another functionality that I mentioned was interferons. Interferons are proteins that are produced naturally by a cell infected with a virus. This is a normal process. And that interferon, that protein, then goes to other surrounding cells that have not been infected by viruses yet, and is sort of like a warning message. It says, hey, there's a cell over here that's had a viral problem. And that then stimulates those other cells that don't yet have a viral problem to produce antiviral proteins. And those antiviral proteins basically are going to interfere with the virus's ability to replicate itself. Viruses depend completely on host cells to replicate them. They don't do anything for themselves. They just carry genetic information and then try to convince cells they come across to take their information and make copies with it. So the interferon stimulates cells in the area to be watching for viruses and to be resistant to viruses when they come along. And that's a natural process. This is a really cool way that we can also treat people with certain viral problems and with certain cancers, is give them interferons, and that artificially, and that will sort of supercharge their body's awareness of viruses and their body's resistance to viruses. And that's one of the major things that goes on in someone who's getting treatment for AIDS or HIV, is trying to really stimulate that body's natural built-in ability to resist as long as it's given adequate warning. And again, some cancers are also treatable that way as well. So really what you're doing there is you're stimulating the body's natural responses to protect itself. So your body can do these things on its own, but if we give it that extra boost in the form of interferon injections, then that's naturally supercharging the body. And anytime you can help the body do its own thing better, that's better than giving some sort of medication that might have some sort of toxic side effects. So that was all innate immunity. That was automatic. That was 24/7 going on. And it didn't necessarily care what kind of foreign particle it was. And it required no learning processes. So they were multi-purpose, free agent immune cells going all over the place. Adaptive immunity occurs after you have been exposed to a pathogen. So you get sick, you get better, and now you have adaptive immunity to it from that point on, at least for a while in theory. So this comes in two flavors: cell-mediated immunity and antibody-mediated immunity. Cell-mediated immunity often involves the presence of APCs, antigen-presenting cells. And basically those are cells that float around and they're looking for antigens. And an antigen is anything that doesn't belong, anything that triggers the we don't recognize this response. So it can be something like an allergen, it can be something like a pathogen that might actually make you sick, or it might be relatively harmless. We also saw antigens when we talked about blood, and the same idea was there. That it was identification for the purposes of determining what belongs here and doesn't. So an antigen-presenting cell will actually grab antigens when it finds it, and then it sort of waves them in the air and says to the rest of the immune system, hey, I found something over here. Come look at it. Check it out. I think it's a problem. So they're sort of like guards. They're sentry duty. They're always watching for things, and if they find something, they pick it up, and then make sure that everybody else has seen it. That can then trigger some cytotoxic T cells and some helper T cells to get involved. And we'll look at those a little bit more here in just a minute. But those are going to kill whatever thing it happened to be presented by the antigen-presenting cells, either by eating it or by otherwise just killing it. And so in that case, problem solved. Once these cytotoxic T cells have been activated and used, then they produce memory T cells. And memory T cells allow you to recognize in the future the fact that we have seen this particular thing before, we've dealt with it before, and here's how we successfully defeated it. And that allows the body to very quickly pull that same defense out and kill it off, in that case probably before you ever notice that you had a problem. Antibody-mediated immunity looks at antigens, and it utilizes antibodies. And we saw antibodies in blood as well. So we'll look at those in a little bit greater detail here in a minute. But in this case, the antibody is also looking for antigens. And if an antibody discovers an antigen that it recognizes, and each antibody type recognizes only one particular antigen, so if it sees something it recognizes, it sort of stimulates the same kind of effects that we saw with cell-mediated immunity. It calls for help, and it waves it in the air to make sure everybody sees it. And in this case, the cell that responds is a B cell. And a B cell will work much similarly to a T cell in a way. And it's going to do a couple of different things we'll look at closer here in a minute as well. But after it deals with that problem, it also makes B memory cells. So we had T memory cells and B memory cells. And the B memory cells do the same thing the T cells did. They remember the problem, they remember the solution, so next time you're presented with that particular thing, it's probably not going to be a big deal. This idea is why often children get sick more often, but as you age and become an adult, you probably get sick less often, and that's because your body, by seeing all these various things, whether you got sick from it or you saw it through a vaccine, and then your body produced these memory cells. And from that point on, as long as those memory cells are functional, then you won't actually get sick from that thing because your body already knows how to successfully defeat it. So getting sick less often as you get older, up to a certain point, then it probably would go the other way. But that's just a result of building more and more memory cells. And then you are protected from a greater variety of things as you go. So let's look at those B cells specifically, because they're doing things a little different. They're not directly killing the pathogen so much. So up here at the top we have a B cell comes along and it gets activated. And then it undergoes a process called clonal expansion. And what it does is it makes the memory cells that we just talked about, and it also makes plasma cells. And these plasma cells then crank out lots of antibodies. Those antibodies then go looking for those antigens, those pathogens, or whatever it is, and kill it. So it's sort of an intermediate process. The B cell makes a plasma cell, the plasma cell makes antibodies, the antibodies go out and basically bind up all the antigens, basically clump them up just like they would with blood cells if they weren't matched properly. And then if they're clumped up like that, they can't actually make us sick. Once those plasma cells do their job, they're sort of exhausted, then they die afterwards. But along the way, again, we made those memory cells, and that was the important part. Here's a drawing of an antibody, this Y-shaped structure. And so, again, the idea is that a particular antibody is specifically functioning on a particular antigen. So if you get a flu shot, Typically, a flu shot has a number of different strains of the flu that are included in it, and that would then stimulate your body to make antibodies for those particular varieties of flu. But they're only good for those particular varieties. So if you are exposed to a variety of the flu that wasn't included in that shot, then the shot didn't stimulate you to make that particular antibody, and it doesn't necessarily protect you. Now, there's some argument out there that I think is probably accurate, is that even if you didn't get that particular antibody protection, that exact one you needed for that particular strain of the flu, having more antibodies from all those other strains makes you a little bit better prepared to deal with any variety of the flu that comes along. So even if it wasn't the exact right strain in the shot, probably having the shot allows your body to deal with it better than it would if you don't. Now, the flu shot's one of those things that it's an optional vaccine. So if you choose to get it, then you're doing your best to protect yourself. And if you choose not to, then you're just rolling the die and hoping that you get lucky. But that's one of those things that the flu doesn't kill the average person. So it's an inconvenience for most folks, and then life goes on. There are 5 different main groups of antibodies, and they're called immunoglobulins, is another word for antibody. So we have immunoglobulin G, M, A, D, and E. And I'm not going to insult your intelligence by reading this little table to you. You're perfectly capable of doing that, but the important thing is these different types of antibodies are focused on different types of things. So that's very useful, and the doctor can look and see what kinds of antibodies are present in largest number, and that then tells them probably what kind of problem your body's dealing with. That's very important to know. Do you have a viral sore throat or a bacterial sore throat? If it's a bacterial sore throat, you can treat that with an antibiotic. If it's a viral sore throat, using an antibiotic would be absolutely useless and potentially very problematic. So they can look at these, and some antibodies are more specific towards viruses. Others are a little bit more focused on bacteria. So that's a little bit of a trick they can use to try to figure out what is going on there. Also, in the world of white blood cells, different kinds of white blood cells are more focused on bacteria. Other kinds of white blood cells are more focused on viruses. So here's an idea of what we can do to actually make antibodies in the laboratory in a way that's very similar to how our body does it, but we can tweak the process a little bit to make it more efficient. You can take a plasma cell. Remember, the job of a plasma cell was to make antibodies. So if you find a plasma cell of the kind that you want to have the antibodies for, you would then hybridize it or merge it with a myeloma cell, which is a form of cancer. And then you get what they've labeled here as a hybridoma cell. And what that then functionally becomes is an immortal plasma cell. So inserting the cancer genes into the plasma cell causes the plasma cell to divide over and over again, but hopefully to never die. And that's really the underlying problem with cancer, is that it divides and divides and divides, and it never dies like it normally would if it didn't have those mutations. So this allows them to produce these kinds of antibodies in the lab in large quantities. And while they could be used as a treatment for a sick person, if you produce a lot of antibodies for a particular problem in the lab, since we've got a lot of concerns these days about coronavirus, let's just apply that here. If we were able to produce antibodies for the coronavirus in the lab, let's say, then we could take someone who has it, inject large numbers of these into their blood, and then that would supercharge their body's ability to deal with it. Now, I don't know that it would be that simple in this particular example of this disease, but the general idea would be that. But where this is really important is in diagnostics. So a pregnancy test, or a rapid flu test, or a rapid any test for that matter, and I'm not really super familiar with the exact testing methods utilized for corona, but it's probably involving this same process. is they make lots and lots of these antibodies in the lab. Then they can take the sample that they take from the person who's sick, introduce the antibodies, and see if they get a reaction. If they get a reaction from these antibodies clumping up a particular thing, and because they know that antibody only clumps one particular thing, then they can say if they found clumping from it, you have that disease. If there wasn't clumping, then it wasn't there to work on, you don't have that disease. So that's the underlying premise of rapid tests for disease. From a diagnostic perspective, this process here is really, really useful. Let's look at the T cell division process. So we looked at the B cells, and so the B cells produced plasma cells and memory B cells. The plasma cells then produced antibodies, dealt with the problem. T cells become activated. They make lots and lots of copies of themselves through what's called clonal expansion, or basically just dividing and dividing. And then they go out there and directly kill problems, eat it up, deal with it. And along the way, they also make memory T cells off on the side, so that those particular things they dealt with is something that's going to be recognized in the future. So the B cells were making memory B cells so that they could be involved in the antibody response. The T cells are making memory T cells so they can be involved in the cellular response. So together, those are going to look for and find, hopefully, problems on cells, in cells, and problems floating around the fluid that haven't yet entered a cell. And hopefully between that, everything will be covered. Cytotoxic T cells actually kill their host by doing something sort of similar to what we saw with the complement proteins earlier, but they bind with this pathogen, and they have some enzymes called interferons that pokes a hole in this target cell. Then they dump a bunch of digestive enzymes through that opening into the cell, basically digesting that cell from the inside out. So chemically destroying it is how the T cells are going to do that. Here we have a target cell, some sort of pathogen here, and these particular T cells have found it, they have attached to it, and now they're shooting in their digestive enzymes to kill it. And probably within a couple of hours, that cell would die very visibly under a microscope and then no longer be a problem. I've mentioned before primary responses and secondary responses in the immune system. So here we see that play out. At day 0, a vaccine is administered for something. And the primary response, for the first time the body sees something, is not very great because you have to go through making these T cells, these B cells, figuring out how to do it, making the memory cells. And so really it's only a what does it take as a bare minimum to get the job done, and that's all there is to it. But then this particular vaccine is administered in a second dose, in this case 60 days after the first one, and you can see the secondary response is a much more powerful response, and it lasts for a much longer period of time, far past 60 days. So what that means is that after the body's seen it before, you had some memory cells already present that remembered how to deal with this, and those memory cells allowed the body to very rapidly make this very specific response that you needed. So you get the fast response, the more powerful response, the longer lasting response. And within reason, the more often a person is exposed to something like this, the longer their memory lasts, the better their immune system is at dealing with that particular thing. So we discovered that some vaccines, one exposure is good enough, and the body probably remembers it forever. But a fair number of vaccines don't get a good enough memory response from memory T's and memory B's to last forever. And so a second exposure we would call a booster. And so a fair number of vaccines require a booster at certain intervals, and that helps to just remind the body, here's what this is, and give it another chance to sort of relearn the system basically for free. And the point of a vaccine is to allow the body to have a primary response to the vaccine, which is probably not going to cause any problems, so that the first time the body is exposed to the real disease, you get a secondary response instead of a primary. This means you don't actually notice that you're sick, probably. You don't feel any kinds of problems. You're probably not overly contagious either. And then you didn't have to go through that learning curve and the illness and the maybe get over it, maybe not get over it kind of thing. So really, we've got a number of vaccines out there, and they're actively working on a coronavirus vaccine. Within a year, they hope to have some results and know whether or not what they're testing will work or not. And so in the meantime, we just have to not really count on getting a vaccine for this, but you just have to hope that when you get it, you are able to defeat it within a relatively short time frame. Then you would have the ability to form a secondary response later on. So the antibody tests that have now come available for corona are basically looking to see, has your body produced coronavirus antibodies? And if it has, that means your body has been exposed to the coronavirus. It has dealt with it. At that point, if you don't feel sick and you're just getting tested for the fun of it, obviously it dealt with it successfully. And that then tells you, for some period of time, you are now immune to corona. You're not going to get it again for a certain period of time. And the only question really is, how long are you going to have that protection? How long is your body going to continue to produce antibodies in the quantities that it would take to protect you? And we're early enough in the process, we really have no idea how long it's going to last. But my personal opinion is that you're probably, after exposure to corona and producing antibodies, probably going to be immune for at least a year. I would expect that most of any issues you would run across with that, you'd be good for at least a year, and time will tell as to exactly how long it's going to give you protection for. Hopefully at least long enough so that an effective vaccine can be developed, and then we can, just like with the flu, greatly mitigate the problem associated with it with reasonable numbers of vaccinations. So those things were what we called active immunity, or active adaptive immunity. There's this idea of passive immunity. And passive adaptive immunity is the temporary possession of immunity based on receiving antibodies for a particular thing, not necessarily making more of them. So just getting them, and once they break down, then they're gone. So an example of this is antibody IgG is capable of crossing the placenta. So going from mama's blood across the placenta into baby's blood. And that then means that whatever mama is protecting against with IgG, the baby is now protected against as well, because that antibody crosses the placenta. And so that baby has protection that IgG can provide as long as baby is connected to the placenta. Once the baby's born, the baby is no longer getting that from mama, so a certain period of time after birth, those levels of IgG would go down because the baby isn't making any. It was just getting them free from mama, and when they're gone, they're gone. IgG and IgA are secreted in breast milk. So this means as long as mama breastfeeds the baby, whatever she's protected against with IgG and IgA, the baby is protected against as well. And so this is a really, really good reason why, if it's at all possible, a mother would want to breastfeed the baby, because the mama is then passing on her antibodies to the baby, giving it immune protection that it's not yet capable of making on its own. But as soon as that baby stops breastfeeding, the baby stops getting those antibodies, and however long they last, then they're gone and done, just like they were getting it from the placenta. A third possibility can be injection of antibodies, and I mentioned that idea earlier. Laboratory-produced antibodies. So let's say you want to go to Africa, but you don't want to get malaria. Nobody wants to get malaria, but if you go to Africa, you're at serious risk for that. So what you can do is you can talk to the doctor ahead of time, and they can give you antibody injections. So antibodies against malaria, basically a temporary vaccine, if you will. So as it lasts for a while, a couple of months perhaps, and that allows you to go into that situation, potentially be exposed, but not have to worry about actually getting it, because your body would immediately kill it as soon as it came in. But once again, those antibodies break down, then you no longer have that protection unless you get another shot. So passive immunity is just there. It's good for as long as the antibodies last, and then when it's over, it's done because your body doesn't make it. Active immunity was making the antibodies actively, as the name active would suggest, and the thought there is the body remembers, the body keeps making that continued protection, so once you have it, good, you probably have it forever after. Here are a couple of different vaccinations that are available, and there are far more vaccines than this particular list, but what it does is gives a list of some of these different vaccines and some different age categories in which it's recommended that you get it or not get it. And you might see 1 dose, 2 dose, 3 doses, and the more doses there are, the more boosters or the more reminders the body seems to need to get the message clearly and then perhaps never need it again. So if we look here at the human papillomavirus, if you get 3 doses of that vaccine across this time frame, then you see no more recommended doses for the rest of life. So the thought is 3 doses of that over a course of a couple of years, and your body's going to remember it forever. Some of these other things like the flu shot, here the influenza, it's not necessarily that that vaccine doesn't give you lifetime protection, but there are so many varieties of flu out there, and they're all the time changing as to which one is the more common one this year or not, and they're always evolving as well. So if you were protected from it now, 10 years from now, it might have evolved into different enough of a little critter that your immune system and your antibodies wouldn't recognize it anymore. So every year it's recommended that you get the flu shot for reminders for current versions and what they've best guessed is going to be the biggest problem this particular year. Now, in the world of vaccines, it's a somewhat controversial topic. And I'll post another video that deals with vaccines very nicely, I think, gives some really good reasons for why vaccines are something that everyone should do. And I think deals with a lot of the concerns that people have about vaccines. And in my mind, completely puts those concerns to rest. But anyway, you'll watch that video as well and learn about some of the history of vaccines and how it works and that sort of thing. And I would just really, really encourage you, vaccinate your children for everything really that's available. Now, some things might be considered optional. So the flu shot, yeah, probably optional. Chickenpox vaccine, yeah, probably optional because chickenpox doesn't kill people either. But some of these are not really optional. Tetanus, not really optional. Shingles, it's really, really rough on a person if they get it. And it typically happens after the age of 60, so probably not really optional there. If you're not scared of measles or mumps, clearly you've never seen a case of them. Meningitis obviously is a bad deal. Hepatitis, everybody knows, would be a bad thing. So some of those things are really, really not optional. Other things are, do it if you want, don't do it if you don't want. It's probably not going to be a big deal either way. So some vaccines, like the chickenpox, for example, have been a convenience vaccine. If you get the shot, you don't have to get chickenpox. And my generation didn't have a chickenpox vaccine. We just got chickenpox. And I had it actually when I was 18 years old. And why I didn't get it before that, I don't know. Because I was exposed plenty of times, but I just didn't happen to get it until I was 18, and that was great fun. So, again, it didn't kill me. It didn't cause any kind of real problems. It was just even a mild inconvenience, really. But I suppose if you can avoid even mild inconveniences, then that's great, too. So, in my opinion, vaccinate your kids for everything. Vaccinate yourself for things that you need to do refreshers on, because the general idea is the vaccine prevents problems. So if you prevented it, you don't have to fix it afterwards. It's already dealt with and done. While there may be negative side effects, the risk of that is next to nothing. But the risk of the real disease is sort of a problem. And what we're actually starting to see now is we're starting to see some diseases, measles and things like that, are starting to pop up again in the United States because we have so many people not vaccinating. And then we're losing that level of protection that we have. So as long as that virus still is found somewhere on the planet, then if we stop vaccinating for it, it can come back all over again. And y'all aren't old enough to know anything real about polio, but polio used to be a really, really nasty thing. It crippled people. It killed people. It was a serious problem. Then they developed a polio vaccine, and polio in the United States is something that you've probably never ever seen. If you do, the case didn't originate in the United States, so it came from somewhere else. And there are only a few countries that still have polio problems. India, Pakistan, Afghanistan, some places like that still have some polio, but they've made great progress in mostly eliminating that disease because of vaccines. Smallpox, as best as we know, has been eliminated since the late 70s because of vaccines. So proper use of vaccines can eliminate diseases completely. It can greatly reduce problems associated with those diseases, and it's just a wonderful thing. So if we don't vaccinate, then these problems that still do exist somewhere will come back and become a problem for everybody. So if you don't want to see another worldwide polio pandemic, then vaccinate your kids for polio. But if you don't vaccinate your kids for polio, then we might see a worldwide problem with polio all over again. And that would be especially shameful because we were so close to eliminating it. Then we got lazy and we said, no, we're not going to do that anymore. And then we let it come back. When we almost had it beat, we just gave up and let it come back. And in my mind, that's completely foolish because we had the fix and we let it come back and get us anyway. And that's just kind of silly. So it's sort of like leaving your door unlocked, hanging open with a great big sign on it, I'm not home, walk around and take whatever you want and I'll never know. So anyway, my personal opinion is everyone who is medically able to be vaccinated should be vaccinated. Obviously, my opinion won't necessarily change things for some people, but I can say that my children are vaccinated for everything that is recommended they be vaccinated for, and as long as they live in my house, they will continue to be that way. Probably the final conclusion of it is, if I provided that vaccine to my child, and it didn't provide the protection that it was supposed to, obviously I'd be disappointed, but I did everything I could. Or if it caused some sort of unlikely side effect, obviously I wouldn't be happy about that, but I was doing everything that was in my power to protect my child. If I didn't give the vaccine, what I'm saying is there's a protection available for my child, but nah, I'm not going to bother giving my child that protection. And if my child then developed a problem because I chose not to provide the protection for it, that's on me. And that's something that I don't want to deal with. So if you choose not to vaccinate your children, you are choosing to not protect them, and you are then becoming personally liable for any particular disease or problem they develop because of your failure to provide that protection. Obviously, it's a personal choice. A number of groups hide behind religious exemptions and religious reasons not to vaccinate, and that's just garbage because the basic tenets of all those religions say take care of yourself to the best of your ability, which includes vaccines. So often religion is something that's hidden behind as an excuse not to vaccinate when really that has nothing at all to do with it. So again, in my opinion, vaccinate, vaccinate, vaccinate. The rewards are well worth it. The risks are negligible. And so for me and my family, vaccines are the way to go. So watch the video if you didn't already have that feeling, and then decide for yourself, obviously, how you feel about it. But I think it does a really nice job of looking at all the options, looking at all the ideas there, and it makes a lot of sense. So just do that. Here we have an immune system problem. This is rheumatoid arthritis. And this hand is becoming quite disfigured, and I've seen hands much worse than this. And this is an autoimmune disease in which the immune system attacks your own body. So it fails to recognize, this is me, leave it alone. And so then it starts attacking the joints of the hands first. Then it will move to the feet and slowly throughout the rest of the body as well. But for whatever reason, it always starts in the hands, destroys the joints and causes them to become very distorted, and eventually will cause the person's hand to lock up in a claw shape. Very, very painful. Your hand loses its functionality because you can't really move your fingers because they're frozen in place, which means you can't button your own clothes, you can't open your own doorknobs, and it's very hard to even feed yourself. A treatment for it would be an immune suppressant drug. The problem with that, though, is you are suppressing your immune system, which means it's not destroying your hands, but it's also not protecting you from other things that it normally would. So there's a trade-off there with that. Just hope that you don't get it. Hopefully everything made sense here and you learned a lot. If you have any questions, you know where to ask those. And have a good day. We'll see you next time.